Interview with Dr. Lisa Indar of the Caribbean Public Health Agency, CARPHA. Dr. Indar, you're here at World Travel Market. Normally you don't see health people at a tourism trade event, but there is a special program that's between tourism and health in the Caribbean. Tell us about it.
Okay. Well, thank you, Johnson. We are here really to talk about a new program called the Tourism and Health Program, which is really geared towards improving the tourism product, hence the reason we're here at World Travel Market, to ensure that our tourism product is healthier and safer. This program is really a collaboration between CARPHA, the Caribbean Public Health Agency, the CTO, the Caribbean Tourism Organization, and the CHTA, where we are coming together as regional tourism bodies to really put together systems and practices and training to ensure our tourism product is healthy and safer, so we have a better marketability.
Okay, so improve the product training, that's a critical element of the entire thing, isn't it?
Yes.
So it's funded, by the way, by
the IDB. So this, we're fortunate, the current program is funded through an IDB grant. And as we go along, we're also seeking other funding such as the CDB and so on. But because of the funding, we're allowed to develop systems that, that are easy to use, that are web-based and easy to apply. So for instance, the tourism stakeholder, like a hotelier or a guest house, will have at his hands really easy tools where if he does see any form of illness or injury among a visitor, he can easily go onto our app, be able to report it very quickly in a very confidential manner. What the app allows us to do, it gives an immediate analysis to say if there's a trend or if there's a problem. And if there is a problem that needs intervention, rapid intervention, the system is built in so that there is a response. So it's really early warning and response so that you avoid all these escalations and negative reports, and TripAdvisories and so on. Because we want the Caribbean to be shown that we have been innovative and proactive so that we don't have large outbreaks, so illnesses.
So it's almost like a preventative sort of measure, is it?
It is a proactive preventative tool.
Okay. So, and you mentioned an app.
Yes.
So you're actually developing an app that will be shared with stakeholders? That works?
So the good news, Johnson, is that the app is already developed. It's called the THIS system, THIS.org, which is the Tourism Health Information System. And, we want to get away from the word surveillance. It's really about a hotelier or a guest house can use this to monitor health, in their system. People coming in with fever or gastro, some signs, that is Zika really a problem? Well, that will tell them no or yes, it gives them a better idea. And this app is there, it's already available. The big thing now is to encourage our tourism stakeholders to use it. It's free of charge, we just want them to use it, and it's available so that their data is analyzed immediately. They don't have to send it to health or anyone, they can see the data for themselves.
Is there fear though that the stakeholders that you're talking about will be worried about reporting that sort of information to you for fear that there might be a backlash?
Right, that's a really good question. So, you have to wait. Yes, everyone is reported. If you do report something, well, someone gets to know. But the fact is, Johnson, people report. We have had a lot of cases which have escalated to large numbers because someone tried to hide it under the carpet. So they think it's not reported, but then the traveler goes on TripAdvisor or on Twitter or on Snapchat, and I'm at this place, they tell you where it is, and then they say, well, I'm getting ill, or I've eaten something and I've gotten sick. What this allows us, the system allows us to protect our brand. If someone is really sick, they may have gotten ill from something they would have picked up from their country, or maybe it's something from the Caribbean, but we can easily alleviate it. In the influx of new illnesses came in through traveling. What does that mean? We want to put measures to stop it, to reduce it to very small numbers so that we can, have a healthy and a safer environment. So while there may be a fear, I think it's much more advantageous to use it because you now have a marketing and a bargaining tool. If I'm a hotelier, at my fingertips, I would know what's happening every day with every one of my guests, and I would be able to make a very informed decision so I can quickly solve the problem and make my hotel, my guest house a better and a safer destination.
I notice you've mentioned hotel and accommodation very often here, but there are other players involved in tourism, such as sites and attractions. How will they be involved?
Okay. Well, in the beginning, we are starting with the bigger establishments. So this is, I say hotels because they're the bigger ones, and then we have the guest houses. But there are also bed and breakfasts and so on. So, it varies by countries. So when we go to a country, we obviously look at what the situation is. For instance, we were just in Belize, and a lot of their average hotel is nine bedrooms. So it varies, and so it's available to every particular facility in a country, because right now there's no cost and it's an app, so anyone can use it. So it's available to everyone. The idea is to start with the bigger ones and the branding, because obviously the more people you have, there's more risk, and then carry it on to the rest of the entities.
You've launched it in a number of countries, haven't you?
We have launched it recently in Trinidad and Tobago, and in Belize as well as Bahamas. And next week we are going to be launching in Barbados, and then following in Bermuda, and so on. So we are moving at a very quick rate, but launching is a process where we actually start for the implementation. What has been really good is the level of commitment shown by the country. For instance, like the TDC, they have actually created a running video of this, and it's available on their website. And Barbados is right now working on a video about implementation, on why it's important. So it really shows that they're committed. But what we really need for this to work is health and tourism to come together and realize, look, there are health issues that do affect tourists. And if we really want to have a better product, we have to work together to address that, so that people can come to the Caribbean, not just for our sun and our sand and sea, but to just healthier and safer. So we have a better marketability over other countries.
So, but you have seen the first step of health and tourism coming together with the CARPHA, you said, and the CTO and the Hotel and Tourism Association.
Yes. Yeah. And that's a great thing. We have started, I think, in the right way. Having a partnership with CTO is very important, and CHTA. We work very closely with Mr. Riley and people like yourselves, and we want to develop a whole marketing campaign about, how we move about it, because it's not CARPHA driven. And I want to really emphasize that. Health can't drive this. It has to be driven by this collaborative approach between health and tourism. So I don't want it to be seen as a health project, really, or a program, because really we are enhancing our tourism product.
Okay, thank you very much.
Thank you very much.